Segment 3, healthcare. Let me give you a quotation and a fact. The quotation comes from you in Basic Economics. Quote, "A long-standing staple of political rhetoric has been the attempt to keep the prices of medical care reasonable or affordable. Yet the amount of resources required to supply the things we want are wholly independent of what we are willing to pay. It is completely unreasonable to expect reasonable prices." That's the quotation. Here's the fact. The United States devotes 17% of its GDP to healthcare. The next country down in that is Switzerland at about 11% of its GDP. So we devote something like 50% more than the next country down. Now, surely it's not unreasonable to suggest that we're just spending too much.
The question is, when people are spending their own money, I don't know how third parties can say it's too much. Well, ironically, Rahm Emanuel's brother, who's a doctor, has on board for this whole Obamacare thing. But really, he revealed why Americans spend more. Americans don't, when they go to a hospital, they are in private or semi-private rooms more often than in countries on government health care. And so instead of being in a ward, you're in your own private or semi-private room. It costs more. American doctors are more readily available. There is less waiting time. Some people prefer to pay in money and other in waiting time. Now, when you have a painful disease and the government tells you there's a 6-month waiting list, that you're paying in a different way. It doesn't show up in the statistics. But you may not even live the 6 months, depending on what you have.
So we pay more and get more.
That's it.
That's it? That's all there is to it?
That's it.
You don't want to say, but at the same time, our system is terribly inefficient in various ways?
No, it's not inefficient for people to buy what they want.
It has to be more complicated than that.
What's inefficient is having third parties decide what you need and don't need. As for example, in Sweden, where and it's not like an insurance company saying they won't pay for it. In Sweden, if they say that you don't need this, you can't pay for it with your own money because they control the whole system. And so your choice at that point is to leave Sweden, which if you're very sick may be a little hard to do, or to have what you need smuggled into you.
Right. Tom, in one of the last conversations I had with our friend Milton Friedman, I recall his saying he was musing about the future of healthcare, which, as you know, interested him for 5. In fact, there are no new ideas, just proposals by Milton Friedman that haven't gotten around to being enacted yet, I sometimes feel. But Milton said the situation we have in this country is untenable over the longer term. And he said, broadly speaking, about 50% of American healthcare is private, subject to the usual incentives of the private market. But about 50% with Medicare, Medicaid, and so forth, about 50% is effectively socialized, run through the government in one way or another. And Milton said, this is untenable. We will probably either go to a much more socialized system in which we will at least have the virtue of controlling prices. Quality may deteriorate, but prices might be controlled. Or we'll go in the other direction and push more of healthcare into the market, which would control prices and improve quality. Does that make sense to you, that analysis?
Yeah.
It's about 50-50, but it's untenable that we're at
I don't know why it's untenable. It's one of the few times I'm sure if he were here,
if he were here, of course he'd say I misstated it or
yeah. But when people want something, and when I was in the hospital last, I had a private room. No doubt that costs more than if I were in a ward.
Right.
Particularly as in Britain, where you can be ignored by the nurses. The women in Britain, one of the scandals is that they are having their babies in the hospitals, but not in the delivery room. I mean, they're having their babies in the hallway and the elevators because they're calling for the nurse, and the nurse will get around to it when she feels like it. And the baby is not going to wait.
Okay, let me ask you then a question about practical politics. One of the points you make in Basic Economics is that the government, politicians, face incentives the way ordinary actors in the free markets face incentives. Yes. So here's a question. It seems to me, as a layman watching things, that the people who are in favor of pushing more health care into the free market have been on the defensive for the last couple of years since President Obama was elected. Now we've had a change in the House of Election, and Republicans have come in, and they are saying we're going to fight this thing every step of the way.
I hope they do.
Well, it still feels defensive to me. We're going to hold up the money here, we're going to file a court challenge there, and it's a kind of a piecemeal attack. How can the terms of the debate be changed, if indeed they can, so that the argument for the market becomes dominant and unself-conscious and aggressive in a certain sense?
Well, that would require articulate Republicans.
All right, on to the next question. No. Well, we have. Are you encouraged when you look at the current Eric Cantor, these new people who've emerged in the House?
I must say, I saw Chris Christie, governor of New Jersey, for the first time. I thought, my gosh, an articulate Republican. When was the last time I saw one of those?
Articulate and also willing to fight.
Yes, yes.